Hey everyone, welcome back to the YMyHealth podcast. I am your co-host for this episode, Melissa Schenkman, and today we're going to be talking about something that I feel like is so ingrained in our generation. And you're laughing as I say this because it's so true. Entrepreneurship. We see a problem and we want to fix it. And I think more than past generations, it's not something we're like, well, someday we'll consider like pursuing this. It's more like, no, let's try as best we can, like start pursuing this now, to fix a problem in the world. But the thing about entrepreneurship is there's no roadmap to success. And so one of the tools that is most helpful, I have found, and other people I've talked with, is talking to fellow entrepreneurs who have been successful and have been making wonderful changes in the world by pursuing this path. And so we're very fortunate to have Dr. Erica Barnell here with us today, and just really excited to talk about this. And just little background for everybody. We're so happy you could come back and join us on the podcast. So Dr. Barnell is the co-founder and chief medical officer of Geneoscopy, which is a healthcare diagnostics company that has been developing really innovative stool-based tests to prevent, detect, and monitor gastrointestinal diseases, so like inflammatory bowel disease and colorectal cancer, which is really changing the healthcare landscape, which is awesome for all of us. And Dr. Barnell has her MD PhD, which she earned at Washington University School of Medicine in St. Louis. And in her PhD, she focused on molecular genetics and genomics, which we'll talk about a little bit as we get into our discussion about entrepreneurship. And most recently, you were named in St. Louis Business Journal's 40 Under 40. Congratulations.
Thank you. Thank you.
You're welcome. That's awesome. And also earlier this year, you with your brother Andrew were finalist for the Ernst & Young Entrepreneur of the Year award, which is awesome too, amongst your many honors for your amazing work.
Thank you. That's very kind to point out those accolades. We're really proud of what Andrew and I together have accomplished.
That's awesome. Awesome. Well, we so appreciate you sharing time with us.
Well, thank you so much for that introduction. Yeah, I couldn't be more excited to talk about obviously my two passions, entrepreneurship and healthcare, and the combination of those two things. Obviously, I've dedicated my career to that, and hopefully today we can inspire some listeners out there to join the ranks and start fixing this multi-trillion dollar industry where everything is kind of broken. So very excited to
Yeah.
be here.
Absolutely. Well, thank you so much. And I really am hoping as well that we can inspire more people to join us. And far as mentioning, you focused in, molecular genetics and genomics. And so you say, how do you go from so many people always want to know, really it's true. How do you go when you're so much in the research world and the academia world, to thinking, okay, I want to become an entrepreneur. So I'm really curious to start, like at what point when you were in your research and your MD PhD program, and as you were starting your career, did you realize like, I want to become an entrepreneur, and why?
Yeah, I think it's why representation and experience and exposure is so important. I think I was exposed to it at a very young age. My grandfather was an entrepreneur. He started a binder manufacturing company in the 70s that he ultimately sold. And then
Wow.
my dad, um, he started a precision medicine billing company 20 years ago that he recently exited. And so, at an early age, I was dragged to the office, and Andrew and I remember back in the day, we were paid 5 cents to pull off shipping stickers. Every time we'd pull one off, my dad would give us 5 cents. And we after that went to Schnucks and got scratchers and donuts with our proceeds. And I think those experiences start compounding. And so I never had the idea that that wasn't possible. I had a lot of examples and support to pursue those avenues. And so I feel very grateful for my background and my experiences. But I do recognize how overwhelming and daunting it might be for people who don't have that experience.
Absolutely. No, that is so, interesting to hear, and those early childhood experiences always stick with you, and that's amazing that you could see so early on, like, this is possible. Like, you can
Yeah.
make this amazing career and this difference, in entrepreneurship. I love that. And in the world of entrepreneurship, what do you think makes pursuing this path in the healthcare space specifically, so challenging?
Yeah, I think people that pursue entrepreneurship and people that pursue medicine are very different phenotypes, right? I think,
Yeah.
we have individuals, a lot of individuals that were in my class at med school who knew they wanted to be a doctor since they were 3 years old, right? And not just a doctor, they wanted to be an orthopedic surgeon. They wanted to operate on, you know, something very specific. And I think brains that gravitate towards medicine are not the best business people. Doctors
Oh,
are
yeah.
notoriously bad business people. And so I think what I've had the benefit of is having education, didactic training in both entrepreneurship from Cornell. I got a degree in applied economics and management, as well as having that background in biology and then ultimately being exposed to the hospital and to medicine and being able to join those two experiences to understand what the problems are and actually be
Mhm.
able to tackle them and put one foot in front of the other to address problems. And so I think again, it's fortuitous that I had those experiences and that tool set that I could then apply to build Geneoscopy.
Which is incredible. And, you know, far as I know, you were mentioning far as your undergrad with economics, but once you were in kind of in the graduate setting, um, did you ever have kind of any type of training, or was there any available? That's always a big question on the business side of healthcare, specifically before you started down the path of
Yeah.
trying to build one. Totally curious. Yeah.
Yes, this crazy path that everybody tried to dissuade me from pursuing. Sure. I I think I again, I had my undergraduate
Yeah.
training, at Cornell. They were or at WashU, they were just
Yeah.
starting to integrate business training into the medical school curriculum.
Oh, wow.
It's since escalated.
Mm.
I think people today have access to so much more than maybe I did 10 years ago, and certainly more than physicians did 20 years ago. So I think that accessibility, the recognition that entrepreneurial training, that just building that tool set of how do I go about doing product development?
Yeah.
How do I file a patent? How do I raise money? How do I build a pitch deck? Building those skills has become more integrated into curriculum and recognized as important across any field. And I think the walls of academia are coming down a little bit in that
Mhm.
regard so that industry and medicine and research can intermingle more effectively without as much contention that there might have been previously.
No, that's very interesting to hear and very promising to hear because to your point, yeah, they are 2 separate worlds, that very much need to be integrated. And so I'm happy to hear that you're seeing that more. And talking about challenges, and I know this is like ask any entrepreneur like what about challenges. You're like, how many would you like me to list along the way, right? So if there's some that stood out for you that you think would be helpful, for other people pursuing the entrepreneurial path to hear. Definitely want to highlight those. Just some of the ones that you've encountered along the way, um, as you've built Genoscopy. And are there any that really surprised you in the process too?
Yeah, I mean, I founded Geneoscopy when I was 24 years old. Um, and I had to quickly learn how to lead people that were much older than me, much more
Mm,
experienced than me, more technically skilled. And I think that was really intimidating. I think being a female founder was really intimidating, kind of balancing the um, being really aggressive and trying to prove yourself with the things that come more naturally to me, which are kind of being compassionate and empathetic. And um, that balance is really hard, especially when you're young. But I think I had a lot of great leadership and a lot of great mentors who didn't really allow me to indulge those imposter theory thoughts that were so intrusive in my brain. And ultimately, as you gain experience and being a mother and learning all the things, the patience that comes with experience in motherhood, I think I've grown into that leadership and become a little bit more comfortable with it, which is very helpful. But I know that if you've never done it before, or you feel like you're too young, or you're a first time founder, and surrounding yourself with people that have more experience than you can feel very intimidating. So that was definitely one of the bigger challenges that I faced personally. And I'd say on the other side, I feel like I have developed a really amazing skill set in leadership that a lot of people don't have, and I think it just took a lot of grit, you know, getting through it and, letting those feelings wash over you so that you come out the other side, more empowered than you ever thought you would be.
No, I really appreciate you sharing that with us because I think that is definitely a challenge. I have been in positions with that before, where and it's also and also even though things are getting more 50-50, it is, these spaces are very male dominated as well. They are. We've made huge strides, but it is that age difference and experience difference. I can totally see that.
Yeah, and I think you look at all these incredible, even the women that are paving the way for us, and the people that are paving the way for us, you look at them and you're like, oh, they've got it together. They know what they're doing. They are polished on Instagram. They've got their
Yes.
PR team, and you have to recognize that it's just people trying to do the right thing, and everybody's got their struggles and everybody has other stuff going on and competing interests. And so just trying to show up for those conversations and do your best and lead and give yourself a little grace is so important.
Absolutely. Well said. Very, very true. And one of the key pieces to being an entrepreneur, and truly I think the most difficult piece, I know I found that myself, is securing funding to support, your vision and the products that you want to build. Can you kind of tell the YMyHealth community about what it was like, to work with your brother who has an expertise in this area, um, on raising capital and various forms of funding and taking, obviously your expertise and experience in research and in medicine and then bringing that to the investor.
Yeah, working with Andrew is one of the greatest privileges of my life. We're opposites in a way that kind of works. I'm
Mhm.
the scientist, he's the strategist, and early on when we're building our pitch decks or our, you know, pitching to investors and putting our data together, and we'd spend so much time, hours, days, months poring over data frames or PowerPoint slides and trying to together summarize our findings and present it in a way that was impactful. Um, I would say that Andrew and I faced a lot of no's, but we faced those no's together. And I think we learned how to use our complementary skill sets to turn those no's into maybes and then hopefully
Mhm.
turn those maybes into yeses. And I think there were definitely some people that were adverse to investing in a family owned business, but I think other people recognize that that bond adds accountability, it adds trust and authenticity. And those are the investors that ultimately pursued investment at Geneoscopy and are, realizing the value that we've brought because we together are collectively better than we are as individuals.
Um, That's wonderful to hear. And, when it comes to thinking about and pursuing the funding streams, I'm very curious, are there any skill sets that you found in the process that you had already developed on the research and clinical side that actually lended themselves well to this aspect of the business and being an entrepreneur?
I mean, it's so funny. Fundraising is never easy at any stage, and we've done it all, right? We've done
Yeah.
the grassroots, we put in our own money, we did a friends and family round, we did an angel investment, we've done VC, we've done, um, in St. Louis, we've done on the coast, we've done strategic investing. Um, it's never easy. And I think it's especially challenging for first time founders. One strategy that worked really well for us,
Mhm.
again, as first time founders, especially focusing on that credibility piece. Every time we raise capital, you don't just engage investors that you think are suited for the round today, but you build relationships with individuals that might be better suited for future rounds. So you can tell them what you're doing, tell them the plan, show them where you're headed, show them how much value you can create with the capital that you're going to raise. And then when you return 2 years later, you can kind of say, look at what we did. We delivered,
Mhm.
we executed. And that is how you can build that credibility or that track record of execution and build the same kind of trust that serial entrepreneurs gain through past successes.
That's a very, very interesting point. I think a lot of us wouldn't think about that immediately, right? So that's really good that you're kind of planting those seeds today for the future at the same time. So, no, very, very helpful to hear. And definitely, because that is honestly the hardest, I think, and the most daunting thing for everybody once they have this idea and how they're gonna help improve the healthcare system. It's the how do I fund the improvement part, right?
And I think especially, millennials take no really hard. Didn't we play a game called like Perfection? And you had to like get all the little bits into a little box before it exploded on you. I mean, we've been trained to do well our whole lives. And so
Yeah.
hearing no's, hearing criticism, hearing those kinds of things, I think hit us pretty hard. And so just getting used to it and saying,
Yeah.
okay. And
Yeah.
moving on, I think that's a skill that I definitely had to learn over time.
Oh, I appreciate that, and that is very, very true. It is definitely a skill to learn to do that, and that is so much a part of entrepreneurship is there are a lot of no's before there are a lot of yeses and have to be prepared, yeah. Definitely, definitely about that, so I appreciate that. Uh, and when it came time to start building your team beyond yourself and Andrew, I think that's also another piece to the entrepreneurship journey that people maybe in the beginning don't realize and what that's gonna look like. And kind of as you continue to grow at Geneoscopy, what has been your strategy for finding the right people who possess the capabilities that you were looking for to advance the mission and to continue, developing on the technological front too.
I mean, your team is everything, right? So I always say that board members are like family. You don't really get to pick them, but your team is like your friends, and who you surround yourself with, and who you choose to be with reflects who you are and the culture you're creating and the work ethic you want to see. And hiring is tough. I think nobody's good at hiring. Everybody gets it wrong every once in a while, but I think there are ways to minimize mistakes and make sure that you're using your resources or your capital very wisely. So, especially for major roles, we try to do contract to hire arrangements, and those can be really invaluable because it gives both sides really a chance to like date and see if it works before you get married. And I think that initial assessment of work, make sure that you're not wasting their time, right? They're compensated for it, but you can kind of see how they integrate into your company before making a long term commitment and making sure that they're aligned with the culture and the values and the expectations. And I think equally important is recognizing when there is a bad fit, whether it's
Mhm.
performance or culture or direction or whatever it is, and making sure that you kind of let those people find a different pathway
Yeah.
when it isn't a good fit. It's never good for the company or the individual when a clear change is needed. And I think we've learned to just kind of rip that band-aid and move forward. And it's been um, better for everybody.
That's very, very helpful to hear and very insightful because I think that that's definitely a big challenge, especially when you've been in a position where you were the, let's say, employee, so to speak, and not the employer, and where you were in that process of making those decisions. It can be hard, especially as a person who's compassionate as well, too.
Yeah, and it's if especially at a small company in entrepreneurship, it feels like a breakup, you
Yeah,
feel passionately, you're working alongside these people in the trenches, and, again, like, to our generation, we're the last generation that didn't ghost people, right? Like, we
exactly.
we called people on the phone, we have memorized phone numbers in our brain, and, I think dating for us is a very different beast than it is nowadays, and I think it's the same way with work and your work colleagues, and, yeah, it can be challenging.
No, absolutely, absolutely. You've been successfully building Geneoscopy for a decade now, which is incredible. In your journey as a health entrepreneur, what in your view have been kind of some of the key milestones that you have reached in the process? And
Yeah,
that and the other health entrepreneurs out there kind of should think about in general, because they're definitely key milestones.
yeah, I think, it's so easy, to kind of keep your head down. And, it's kind of like you're climbing a mountain and you've got your head at your feet and you're trying not to misstep or fall on rocks or fall in crevices. And eventually you get to the top of the mountain or somewhere on the mountain and you kind of look back and you reflect on everything that you've accomplished to your point over a decade. I have many more wrinkles now than I did when I started the company, but I have so much that I'm grateful for that we've accomplished. We've built a huge CAP-CLIA laboratory to process samples. We ran a 10,000 patient prospective clinical trial. We've engaged with the FDA. We got FDA approval for Colosense.
It's
We've
awesome.
built the team from, me and Andrew to 75 people. We've raised over 200 million in funding across multiple venture rounds. And I think what I'm most proud of is, this past year, I got a real test from a real patient. And I saw these individuals go on that were positive to go get a colonoscopy and have lesions removed. So, I think for me, being able to say, yeah, I spent 10 years, but I'm actually impacting lives and saving patients in the same way that physicians do, which was always a lifelong dream for me, is it's surreal to think about.
It's incredible, and the milestones you've reached are just absolutely incredible, and I can see how unbelievably rewarding that is, and y'all are, I mean, there's no question about it. You're gonna be you're already impacting lives, you're already saving lives, you're gonna save so many more as time goes on because this is such a huge problem, as we both know, in the country with colorectal cancer and prevention of it, so making a big difference.
Thank
And
you.
yes, and very much appreciate that. And in terms of, just in general for as other people are listening to this and they know they have an idea on how to um, do something in some aspect of the healthcare system, because as you said at the beginning, like, where does one begin? There's so many different problems that need to be addressed, right? And so any particular general key milestones that people should think about, and I know funding and the financial part is one of them, but
Yeah.
yeah.
It's very much the Shel Silverstein How to Eat a Whale. It's just one bite at a time. I think at any given moment, there's always competing interests and being able to prioritize, what can I do today? How can I spend my time and my resources in a way that is optimizing for building value. And I think there are several fronts that you have to be fighting at the same time, whether it's building intellectual property, building the product, understanding the regulatory landscape, fundraising, making sure that you're covered from a marketing or a team perspective. And especially in healthcare, where there are three different entities: the patient, the provider, and the payer. They all
Mhm.
have misaligned interests, they all have different needs, and fulfilling all of those needs at the same time can be very challenging. So, I think, every company is different, every idea is different, but just you can't you can't keep moving forward without just trying. And
Yeah.
I always say that, you know, your biggest failure is not trying, and you can't really fail until you're 6 feet under. So pivot, fumble, fall, stumble, whatever it is, but just pick yourself back up and keep going. And um, when you're persistent, I think good things tend to happen.
Oh, that's very empowering, and that's gonna resonate with so many people because this process is a lot about up and down, things don't work, but then things are successful and it goes back and forth and you have, staying the course for that. So it really is very empowering to hear that from you, especially given the level of success that Geneoscopy has achieved. So thank you for that. Both from me, from Julie, and all of our listeners is very helpful to hear that. And and speaking of, milestones, what would you say are, and I know you have 10 years worth here, so we'll go with 2, you may wanna put in a third, of the most, exciting things, you've gotten to experience as a result of starting Genoscopy, and I know about one thing in particular that wasn't too long ago where you got to actually share a byline with somebody who was on Dawson's Creek, which our everyone in our generation is very familiar with and many are a fan of. Yeah.
Yeah, I think one of the coolest moments is it's funny because I think there are big moments like FDA approval, right? And
Yeah.
there's little moments that probably nobody else recognized, but they kind of shape
Mhm.
who you are as a person. And so I'll give you a big moment and a little moment. Yeah, a
Perfect.
big moment was sharing a byline with James Vanderbeek. So cool. 12-year-old me's dying. And Dawson's Creek is just back on Netflix. So,
Yeah,
for my girls out there who watch, it's ready
it's
for a rewatch.
amazing. Yeah.
Um, and I think the little moment for me is I had the honor of attending a summit for chief medical officers at a cancer screening event, a big one. And, I saw 8 chief medical officers at the table, including myself, and I was the only female. I was the youngest by decades. And
Wow.
when you're thinking about a landscape of colorectal cancer screening and who is shaping that landscape, who's contributing to how we treat patients, it's an honor to be among the individuals that is creating the guidelines and the tests and the medicine that we're delivering to patients, and
Yeah,
hopefully being representative of a population that gets colon cancer, but
that's
is not
right.
maybe at that table. I feel really honored, and it's a privilege for me to be at that table, metaphorically and physically, to be able to
Mhm.
speak on behalf of individuals like myself who are very passionate about this cause. And you know, we're only we're one of a handful of companies that is FDA approved for colon cancer screening, and it's the most preventable but least prevented cancer in the United States. So, again, I'm just honored to be a part of that group of individuals that's shaping how we improve treatment and detection of cancer.
Oh, well, that's absolutely incredible to hear, and we're so grateful that you are at the table, that you are representing our generation who is being so affected by this, and it's just so great that your voice is there, and I wish I could say I'm surprised that there weren't other and I know you feel probably the same way, that there weren't other females, and that's the whole point, like, every day, all the hard work that you've put in all this time, like, it's making such a difference, it's paving that path for us as female entrepreneurs, but also, like, in this healthcare space that millennials aren't as recognized, as they should be as well. You're blazing that trail, so I think that's incredible, uh, that you had that experience.
And I do feel, I have so many amazing female CEO mentors,
Awesome.
Ann Wojcicki, the CEO of GSK, there's so many out there. But yeah, let's get some more. Let's just get
Yeah,
some more. Why not?
absolutely. 100%, 100%. And, speaking of which, that segues so beautifully and into the next question I was gonna ask you is, you've accomplished so much and you've helped so many people in this past decade, um, and it takes so much time and sacrifice to get to where you're at. And for the many women listeners in our community throughout our YMyHealth's own journey, we have a very large percentage of our community are women. What are some of the challenges that you have faced as a female founder, female health entrepreneur, and how have you overcome some of those in your career?
Yeah, there's a line from a book that says it actually doesn't take much to be considered a difficult woman. That's why there's so many of us.
I love
And
that.
I think that sentiment resonates really deeply with me. Being a female leader in a predominantly male dominated field is uniquely challenging. And beyond the work needs, I've navigated infertility and pregnancy and postpartum recovery and motherhood all while trying to grow a company. And I think there's a lot of moments where those personal experiences took center stage and you have to move the business to the back burner. And it's a reality that so many women very quietly balance for fear of retribution, for fear of not being taken seriously, for fear of, whatever it is. And so I would just say that embrace your needs, embrace what you want outside of the company. Don't sacrifice your life for the
Mm.
company and be very clear with your directs, with your superiors, with your individuals at the company, what those needs are and kind of be unabashedly, own it. I think motherhood has made me a better leader. It's given me perspective and patience and I I wouldn't trade what I've done for anything on a personal level, even if it meant a little bit of sacrifice on some of the things we might have been able to accomplish at the company.
That's incredibly helpful to hear and so heartwarming. I think you're right. So many people quietly face these different personal challenges as women and especially on the fertility. I know so many people, and you still have to, you're still working and building your career, while having all of that going on as well, and people just don't realize how hard that is and the choices, you have to make with time, what your time is available. So really appreciate you saying that and bringing that perspective to us.
So
Thank you. And as we wrap up this episode and you kind of think back on your journey with Geneoscopy, what are some of the lessons learned that you would like to share, and want fellow millennials to know, particularly those who want to either themselves, they want to become an entrepreneur, or they're already on this path, to building their own venture?
I'd say don't wait. Just start, you know, experiment, build, dabble. Whether your goal is to make the next unicorn or just develop an entrepreneurial skill set and try something new, I think taking the first step is the best thing you can do. I think I've learned by doing, not by waiting for the perfect time or for permission. And again, I think when that self doubt creeps in, remind yourself that somebody has to build our future. So why not you?
That's incredible advice. Absolutely. Absolutely. Well, thank you so much for, yeah, for sharing all of your insights with us. I mean, this is just so valuable to hear from you about your experiences and all, just how to go about this path, because it is a challenging path, but it is such a rewarding path. And know that so many of us, that we're not alone in having these feelings or experiencing challenges along the way, and there's a lot of success and reward to be had in helping others in the
Yeah.
process.
I've definitely felt that. So just preaching to the choir here.
I love it. I love it. Well, thank you so much, Erica.
Thank you, Melissa. So grateful to be here.